Hello, everyone, and welcome. Before I even get started, I want to thank you all on a couple levels. First of all, I want to thank you for taking the time to be with us this afternoon. I know your time is very valuable, and it's hard to carve out a chunk of time like this, so thank you so much. Most importantly, though, I want to thank you all for being customers. Everyone that's with us today is a community health center that is an athenaPractice customer as well, and your business is incredibly important to us, and I can't say thank you enough. So I'll keep doing that. My name is Tim Kelly. I'm an executive director here at Athena. I've been here 13 years, which is hard to believe. Just hit my anniversary, as a matter of fact. And I've done a bunch of different roles here at the company. Right now, I lead a program that's really designed for organizations like you. So our athenaPractice customers who want to move from athenaPractice to athenaOne. So that's why I get to be your host today. So let's go through a couple of things here, get us started. So we already hit the thank you. So here's what we're going to cover today. So everybody who's on the call today is at some level of thinking about moving from athenaPractice to athenaOne. Some of you, this may be sort of the first time you're venturing into this, and others of you have been doing this, been looking at this and going through a process for a while. And this presentation is geared towards just giving you more information about what that move might look like. So we're going to start off by really, again, focusing, because everybody here is Community Health Center, focusing on our investment in CHCs and what we're doing, what we've been doing for many years, and how important CHCs are to Athena Health. Then we'll get into a demonstration, and so just give you again a look. It's not going to go super in depth, but give you a good idea of what athenaOne would look like for a provider in a community health center. Then we're going to have our VP of Customer Success is going to come on and talk about our customer success managers and that program. Now, you all have CSMs today, and there's a fantastic team run by Rhea Davis. But the CSMs on the A1 side have more tools, and sort of it's a different business model. So Ken's going to talk a little bit about that. And then we're going to save the best to last, of course, which is we're going to have one of our customers come on, and you're going to hear directly from a customer who made the move from athenaPractice to athenaOne. And obviously, it's a community health center. All right. Oh, and then last, I should just say we're taking questions. So if you want to ask a question, if you hit that Q&A button and then type in your question, we'll monitor those as they come in. We'll try to work them in to the presentation. And if there's something we're not able to get to, we'll follow up with you afterwards. All right, now I'm gonna take a little bit different approach here for a second, so bear with me. And no, this isn't the wrong slide. So I'm gonna start off by asking the question of whether LeBron James should mow his own lawn. Again, you're wondering, what is this doing in here? And by the way, that is LeBron James, and that is him mowing a lawn. It was from a commercial he did a few years ago. And by the way, if you were to Google this, and please wait until we're done with the presentation, but if you Googled should LeBron James mow his own lawn, you'd actually find some material on it. And it's just an interesting sort of fun way to look at an economic principle that's really important to us at Athena. And so here's the hypothetical idea. Hypothetically, LeBron is very good at mowing his lawn. And in fact, he likes to mow his lawn. And he can mow his own lawn in an hour, which is probably amazing because his lawn is probably huge, right? Now, down the street, there's little Jimmy who lives down the street. Little Jimmy can also, he's got a lawn mowing service, and he can mow LeBron's lawn, but it takes little Jimmy 2 hours to mow LeBron's lawn, and it takes him 2 hours, and he charges $20 an hour. So the question then is, should LeBron pay little Jimmy $40 to mow his lawn, or should he keep that money in his pocket and do it himself? And one might think that the prudent or the less costly thing to do is to keep the money in his pocket and do the lawn mowing himself. But think about it. What is LeBron James? He's one of the greatest basketball players of all time, and he's a celebrity. So what could he be doing with that time instead of mowing his lawn? He could be doing a Nike commercial and make like $1 million in that hour instead of mowing his lawn. He could be honing his craft as a great athlete, improving his skills such that he can get millions of dollars more in his next contract in that hour, right? So those are his comparative advantages, right? That he has a comparative advantage of being a celebrity and being one of the greatest basketball players of all time, right? It's not in mowing his lawn. So of course he should pay Jimmy the $40 and focus on where he's got the comparative advantage and where he can make the most money and make the most use of his skills. And so how does that compare to you all? So I've gathered mission and vision statements from all the folks that signed up today. There's another slide, but we'll hit on a couple of them as well too. And so when you think about what is your mission or your vision, and I'll hit on just a couple of these here, please take a look at all of them and look for yours on here as well too. But as an example on this first slide, MHC, your mission is improving our community by providing exceptional whole person healthcare. Tells me a heck of a lot about who you are and what you're all about, right? Now I go to the next slide here. I'm pulling off Chase Braxton. You folks, your mission is to provide compassionate and integrated high-quality healthcare that honors diversity, addresses health inequities, and advances wellness in the communities we serve. Again, it tells us a lot about who you are and what you need to do to deliver on that mission. And ultimately, if you think about it, what we want to do at Athena is we want to mow your grass, right? We want to be able to take care of those things that aren't your comparative advantage. They're the little things like, managing documents and posting payments and doing some of the mundane things that aren't fundamental to you delivering on your mission so that we can help you deliver on that mission together. So think about that, if you would, in context of everything you're going to hear today, because that's what we're all about. We also are a mission-driven company. All right, hopefully that's a good setup for us to get going. And what I'm going to do now is I'm going to turn things over to Jeff McGinnis from our CSM team, who's going to talk a little bit about our investment in community health centers. Jeff, take it away.
Thank you, Tim. Hi, everyone. I'm Jeff McGinnis. I'm the FQHC Specialty Program Manager here at Athena Health. I am relatively new to Athena. I have just been here a little over 2 months, but I've spent my entire career working with community health centers and also using athenaOne as a user. And so I'm just very excited to be with you all today. And I want to talk about some of the leading reasons why so many of our former athenaPractice customers have converted to athenaOne, and particularly what you need to consider as you evaluate converting to athenaOne. And to start out, I want to share this image as a reminder that Athena Health has been on a multi-year investment in community health centers. And this is nowhere near the end of the journey. And this year, we're really trying to bring together all of the pieces for a comprehensive solution for our health centers. Our footprint has expanded to over 13,000 FQHC providers, over 233 health centers and counting, making up 20% of the market. Of our 233 health center customers, nearly 20% of them converted to us from athenaPractice, making up almost half of athenaPractice FQHCs. And we know that health centers aren't only a safety net, they're foundational to the country's primary care infrastructure. Health centers lift up and strengthen communities, whether urban neighborhoods, rural towns, or tribal lands, and you deliver care to 1 in 10 Americans while ensuring access to care where it's needed most. I don't need to tell you that this is a moment of unprecedented uncertainty because health centers are living that every day. But you aren't backing down. You continue to innovate, adapt, and push forward because that's what your missions demand. And we see that. More importantly, at Athena Health, we're not backing down either. While others may be pulling back or waiting, we're really leaning in because we believe and we know that health centers are an integral part of Athena Health's vision. And that vision is to create a thriving ecosystem that delivers accessible, high quality, and sustainable healthcare for all. We feel like that's really closely aligned with what health centers are looking to create today as America's primary care centers. So I want to dive into some of the ways that we approach developing product and particularly how we focus that towards health centers. Our product organization enters each year with a set of divisional priorities for the network. At the highest level, our product roadmap is organized around 5 divisional priorities. These themes drive every decision we make as an organization to ensure we're continuing to build and iterate on the product in ways that elevate the entire experience for our users end to end. Within these higher level priorities, our community health leads are going a level deeper, incorporating the very specific and unique elements health centers need to be successful. I'll review some of those key focus areas momentarily, but even at the highest level, you can see our divisional priorities are well aligned with many of the priorities emphasized for community healthcare. The first is improving care team efficiency and satisfaction. One of the most significant challenges health centers face is attracting and retaining a strong workforce. We were talking about the LeBron example earlier, but clinicians should not be burdened by inefficient workflows, incomplete patient data, or a one-size-fits-all clinical experience. Our investment here is intended to ensure that care teams are providing optimal patient care with minimal mental and administrative load. The next pillar here is enabling success at value-based care. Our entire network is participating in a wide array of reimbursement models with a full spectrum of experience in value-based care. Some members within our network have an extensive range of full risk contracts, with others just beginning their journey into value-based care programs. Our goal here is to ensure no matter where you are on that journey, Athena is providing both the tools and expertise to ensure you can manage populations at scale, surface relevant and actionable data to close gaps at the point of care, and make it easier to continue to see patients in the most natural way without worrying about clunky workflows and added visit time simply to achieve measure satisfaction. The next item is providing a consumer-grade patient experience. We understand that patient care goes beyond the walls of the clinic, and many patients have a choice for where they want to be seen. Providing a consumer-grade patient experience is about both satisfaction and improving patient health. It's impossible to treat the patient if you can't find the patient or connect with the patient. And we want to ensure that it's both easy for patients to engage digitally with their care team and that providers are able to follow up early and often with their patients to ensure they're getting routine care and being screened for early intervention to prevent high costs and high risk issues longer term. The next is improving practice management and revenue cycle performance. Again, our network is reimbursed under a wide range of fee-for-service, PPS, APM, and value-based payment models. And no matter what kind of an organization you are, strong financial health is the underpinning of strong patient care. No margin, no mission. Our organization is investing in the end-to-end revenue cycle experience to improve transparency, improve configurability, and accelerate reimbursement in full. And we're really doing this particularly with health centers in mind. Lastly is building a durable and open ecosystem. As a single instance multi-tenant platform, athenaOne is the most open network available, and we want to continue to lean into those capabilities. Our goal here is to ensure we're going well beyond basic data exchange and offering out-of-the-box connectivity, creating a creative development platform for innovation and deeper capability for clients of all types. That goes beyond providers. That includes facilities and payers and partners, so they all can configure their experience in athenaOne. Now that I've shared a more high-level view of the divisional priorities that go into our product roadmap, I want to zoom in on 3 major areas of focus that reflect the needs of health centers today. The first is driving workflows and reporting to deliver and demonstrate high-quality patient outcomes. That includes full visibility into the patient records across external sites of care, specialty roadmaps for women's health, behavioral health, and dental, addressing health-related social needs or social drivers of health through extended care management workflows, and driving smarter, more efficient care through clinical decision support and AI. The next is one that's particularly salient right now, is ensuring health centers are maximizing reimbursement by capturing every dollar eligible. You'll hear we're really rethinking end-to-end RCM experience to ensure accurate rules formatting, automated posting, and transparent FQHC-specific reporting. And particularly improved issue resolution for faster turnaround time on cases to support to adapt to a changing payment environment. Lastly, we're really focused on providing tools that support diversified revenue streams beyond PPS. In addition to working to make sure health centers are ready for UDS+, we're empowering health centers to be successful under a wide range of value-based care models, improving patient pay, efficiency, and schedule density, and supporting community engagement with communication tools and to expand your payer mix beyond Medicaid and really retain your patients. I want to dig into that last pillar a little more. We understand that health centers are being called upon to diversify their revenue sources beyond the traditional Medicare and Medicaid PPS models that have been around for so long. And this is really about ensuring ongoing financial stability. Health centers are navigating a variety of value-based payment models that differ across states, payers, populations, and evolve year over year. And to support them on that journey, health centers need a nimble system that can transform alongside them. At Athena Health, we believe a strategy around each of these 5 areas is required to maximize value-based care success. This is a helpful visualization of what we mean by that, but it only really scratches the surface of what athenaOne has to offer. We try to approach value-based care the same way that health centers approach the patient journey. We break down value-based care into 5 core capabilities, all integrated within the Athena Health platform. The first is predict and identify, helping health centers understand their patient population, identifying those needing care by condition, and determining who requires additional intervention. And that includes social driver of health capture and surfacing those details in the patient chart. Through using Prepare and Z codes, leveraging a care gap work list, care management programs, the quality tab, supporting HCC capture and risk adjustment, APIs to support risk flags, and a variety of care management support tools and admin discharge transfer alerts. The next is coordinating care, to really go beyond the office setting and coordinate interventions like medication adherence and dietary changes for all care providers in supporting health center patients. That includes things like our athenaOne care plans, integrations through athenaPayer, national connectivity to Commonwealth and care quality, our chart sync tool, document management and services, as well as any variety of interfaces, local networks, health plan data exchanges, and APIs. The next is care delivery. We want to make sure that providers have the best patient information to make informed decisions, delivering high quality care and that's optimized both for value and cost and supporting improved patient outcomes. It involves servicing HCC and care gaps from network payers and other data sources, care gap alerts, clinical decision support, using encounter plans and templates to accelerate the documentation process, real-time benefit check to make sure that you get paid for all those visits, and a variety of additional features to support the complex nature of billing and reimbursement for health centers. Next is engaging patients. We want to empower patients with information about their care, understanding the next steps, their role, and really getting them connected and being active participants in their health. That means using the patient portal and the athenaOne app, using automated wellness outreach tools and appointment reminders, offering after-hours operators to make sure your patients can reach you when your offices are closed, auto-publishing results to the portal, and supporting messaging between providers and patients through AI draft responses. We also have a variety of patient education, patient education resources within the chart that are delivered to patients, care summaries and messaging, and tools like telehealth and pharmacy alerts. The next is measure performance, and this is so important. So being able to thrive under value-based payment really requires that you can demonstrate that so much of that work that is at the core of what health centers do is being presented to the payers that you work with. So continuously evaluating and improving the quality of care by measuring how we predict, coordinate, deliver, and exchange information. That includes built-in UDS and HEDIS for quality reporting, opportunities to integrate with ACOs, health plan data exchange offerings through athenaPayer, surfacing care gaps from our payer connections, surfacing HCC coding opportunities I referenced before, and supporting quality submission and quality reporting more broadly. These capabilities form the foundation of our value-based care offering, embedded in our products today, and supports health centers in maximizing and diversifying revenue sources, particularly in this evolving value-based payment environment. All right, that was a lot about value-based care. Before I hand things off for a demonstration, I want to emphasize that Athena Health truly values the engagement and feedback of our health center customers. Your health centers are pushing the limit of care collaboration and are the source of some of the most exciting and innovative cases for Athena to accommodate. Our health center product leads engage with our customers through our monthly user groups, the triannual roadmap webinar series, the product research page in the success community, the FQHC quarterly newsletter, through partnership with NAC and PCAs, and of course, through partnership with your CSM. And now I'll pass things off to Laura Burgess, one of our managers with our Client Solutions group, who will lead you through a demonstration of some of the top features in athenaOne.
Thank you, Jeff. I'm excited to be here with you all today. My name's Laura Burgess. I'm a solution consultant. I've been at Athena for 11 years, and my job is to help you all visualize athenaOne workflows. Our goal is to tackle the most common questions from those considering a switch to athenaOne. We do have a robust suite of tools available to support your needs. Given our tight schedule, we won't be able to take live questions, but please submit any you have, and we'll ensure they are shared with your sales executives, who will follow up to arrange a more in-depth, customized demo for your team as soon as possible. Please also note that we won't be covering dental services in this session, but we will showcase what we can within the limited time we have. Again, we'll make sure your contact follows up to address specifics in a one-on-one demonstration or discussion. So with that, let's go ahead and get started first with a demonstration of the athenaOne mobile app. All right. So the athenaOne mobile app supports the full clinical provider workflow. As a provider on the athenaOne mobile app, I can log in with my fingerprint or with facial recognition, and that'll bring me to my homepage. In my homepage, I do have my inbox where I can manage my tasks, such as incoming lab or imaging reports, or even manage patient cases. And I can even initiate a phone call right from my iPad to contact the patient, and I can do so while hiding my phone number. I can also view my schedule to see patients who are ready for me. I can use voice for navigation. I can view an entire patient chart, place orders for prescriptions, labs, referrals. I can document a patient visit using dictation, text macros, templates, and save findings. Another method of documenting in the mobile app is using ambient notes. I'm going to play a provider, and I'll invite Tim Kelly to be my patient. All right, Tim. So when I go into the exam room, all I need to do is click on Start Ambient. And then I'd want to make sure I get consent to let the patient know that this visit will be recorded. All right, Tim, you ready to get started?
I am indeed.
Hello, Tim. It's good to see you again. How's your family?
You're doing good, thanks. No complaints.
What can I help you with today?
Well, I have this rash on my arm, and it's been bothering me for a few days now.
Have you noticed any changes in the rash over time?
Yeah, it started as a like a small patch, but it's spread and become more inflamed. I've been applying this over-the-counter hydrocortisone cream, but it doesn't seem to be doing much.
Hey, does the rash itch or cause any discomfort?
Yeah, it's quite itchy and sometimes stings a little too.
Have you used any new soaps or lotions, or have you been exposed to anything new or unusual?
I don't think I've been exposed to anything new. I've been using the same soap and lotion that I always do, but now that you ask, I'm thinking about it a little more. I was hiking last weekend, and I may have come in contact with something.
Okay, that may be it. How have you been feeling otherwise? Has your asthma been under good control?
Well, after the hike, I did have to use my inhaler more than usual, but it seems to be getting better now. It's okay.
All right, so I'll have you roll up your sleeves. Let's go ahead and take a look at your rash here. Let's see. So it's red. It's a raised rash on the medial aspect of the right forearm, approximately 10 by 5 centimeters, without any drainage. The rash appears to be localized to the right arm. And let me listen to your lungs. Take a few deep breaths for me. Right? So Your lungs sound clear. I don't hear any wheezes. Air movement is good. And based on the appearance and symptoms of the rash, it's likely a contact dermatitis. Sometimes even small changes in products or exposure to certain plants or chemicals can trigger an allergic reaction. I'm going to prescribe a topical cream to help alleviate the itching and inflammation. Additionally, I recommend avoiding any potential irritants or allergens that may have caused the rash.
Wow, thank you, doctor. Is there anything else I should be aware of?
Yes, please apply the cream as directed and keep the affected area clean and dry. If the rash doesn't improve within a week or if it worsens, please schedule a follow-up appointment. It's important to monitor any changes.
Understood. Thank you for your help, doctor.
You're welcome. If you have any further questions or concerns, don't hesitate to reach out. Take care, and I hope you feel better soon.
Thanks so much.
All right, so I can use this pause button in the center if I had to step out of the room or if I were interrupted for some reason. But you'll see I'll also have the option to exit and resume later or preview the summary. I'll go ahead and send the summary to the chart now. This will just take a few seconds. So ambient notes can help clinicians to easily record patient visit conversations, automate visit note generation, and seamlessly place the visit note into the patient encounter. The use of ambient listening and generative AI is going to really simplify clinical note documentation and improve the visit experience for clinicians and patients. This will just take a few more seconds, and then our note will generate. We have the reason for visit note that populated, as well as our HPI note that populated, all based on the conversation that Tim and I had. There is the option to edit this if I needed to make any adjustments or maybe add some additional information. I have my review of systems that populate all the descriptions from the interaction with Tim. Now, in addition to the ambient listening, I can still also use some of my document accelerators like save findings, some text macros, and templates. These documentation accelerators are also available on the desktop version. Now we'll see our assessment and plans does note the contact dermatitis as well as asthma as the diagnosis, although it won't populate the coded diagnosis or an actual order for today, but that is on our roadmap. So I'd want to still add the diagnosis or order from here. All right. So once I've added my diagnosis and I've added any orders that I wanted to send the patient home with today, I would go to my sign off and I can go ahead and review the encounter and close this encounter to move on to the next patient. So now that we've looked at the athenaOne mobile app for providers, let's take a quick look at the patient portal from the patient point of view. Bear with me just a moment here as I switch screens.
Hey, Laura.
Yeah.
This is Tim. While you're doing that, a question came in. If you don't mind trying to multitask a little bit, there was a question that came in that said, "How are conversations?" So, like with the ambient tool, how are conversations like this going to actually capture all of the required questions to meet reporting measures?
That's a good question. So it really is honing in on the conversation between provider and patient, and with that, going to produce that encounter or that summary. Now there is some kind of things in the background that'll take place to make sure that it does capture those things, but we can definitely have a deeper conversation regarding that in a follow-up demonstration.
Excellent, thank you.
Of course. All right. So we're going to take a quick look at the patient portal from the patient's point of view. The patient portal is a high-quality patient experience tool that allows health centers to retain and attract a diverse range of patients. On the patient portal, patients have the convenience and flexibility to view their test results, manage their upcoming appointments, self-schedule or send appointment requests. They can prepare for these upcoming appointments by completing an online self-check-in ahead of the visit. The online self-check-in will walk the patient through a review of their demographics, their preferred pharmacy. They can sign forms digitally, pay any outstanding balances or copays. They can also complete screeners like the PHQ-2, the PHQ-9, or the Prepare screener. Patients also have the ability to send and receive secure messages. They have visibility into billing and can make payments or even initiate patient payment plans. They also have access to patient care summaries and patient education, all from the patient portal here. Now, patients can access this on a desktop computer or a laptop, but we also have athenaPatient, which is a mobile app version of the patient portal available for iPhones and Android. And we'd say patients are pretty happy about this app. We've had 800,000 total monthly active patients using the app, and 90% of patients left a 4 or 5-star review. So we've looked at the mobile app for providers, and we've just looked at the patient portal quickly for patients. Now let's look at athenaNet. So Athena is a cloud-based or an internet-based solution. And really what that means is real-time access to Athena whenever and wherever. The center panel on my home screen is my schedule or patient list. The right-hand side is the messaging board, and you'll see some training and resources here towards the bottom. We push out 3 major releases a year in spring, summer, and fall, plus continuously nightly updates as well. These updates are included at no cost and non-disruptive to your workflows. The left-hand side is my task list, and we also call this the workflow dashboard, which we'll talk about more here in a moment. I'm just using my laptop today, but you can access Athena again using a desktop computer, laptop, or tablet. Athena is permission-driven, so your role determines your homepage view and access. Now, in the essence of time, I've completed a patient visit, but I'm going to walk through my demo patient, Miss Judy Turner. Now, before we go to Judy's visit, let's first talk about or start with pre-visit management. Now, this is the care gap work list. This page allows you to view and act on care gaps for patients with upcoming appointments. The care gaps here are identified by Athena supported quality programs such as HEDIS, MIPS quality, and clinical guidelines, as well as gaps identified by payers such as Anthem, Humana, and Optum. So a clinical staff member can use this list to identify patients with open care gaps who are coming to the office the next day. And that staff member can start to queue up orders to satisfy these care gaps and also add notes to the encounter. Or you may have a quality manager who may want to identify patients with upcoming appointments who require certain preventative care measures. These care gaps are going to correspond to the patient's quality tab in the patient's chart. Now what I'd like to do is move into the check-in stage of a patient's visit. So I'll go back to my patient's visit with Miss Judy Turner, and we'll take a look at the check-in stage from the front desk point of view. So Athena will send out appointment reminders via phone call, email, and text message, and even include live operators to assist with scheduling and rescheduling those appointments. On this check-in screen, we can see the patient's banner at the top holds the social determinants of health field or the FDOH field, these are customizable. Also on the check-in screen, the system will flag if there are any patients who do not have an insurance card image on file. We know how important this is for revenue cycle. It will also flag staff of any sliding scale programs that are about to, or plans that are about to expire, or that the patient may be eligible for. So all the data collected here at the check-in stage flows to the appropriate report. So it's the UDS report, and we'll take a look at that a bit later. But you'll also start to see some yellow fields or required fields. This is going to guide the staff on what information needs to be collected. As I'm moving down the check-in, you'll also see some patient portal registration statuses here. Now, you'll also see the financial fields indicating this patient's social determinants of health as well. Athena does have an automated insurance eligibility check that starts 3 days ahead of the visit, and on-demand eligibility check with payer-provided benefit details. We also do have a sliding fee schedule based on the poverty scale that's updated annually when released by the federal government and maintained by Athena. But you can also create your own custom sliding fee with flat rates or percentages or both. Now, if a patient is listed as cash pay or self-pay, we do have a coverage scan to help identify patients who may have Medicaid coverage and may not be aware of it. And then lastly here, we'll see patient responsibility that's displayed. So staff doesn't have to guess what they should be collecting in terms of an outstanding balance and a copay. And that's pretty much it. That's the check-in screen. So now that the check-in is complete, the patient goes to have a seat in the waiting room, and then the back office is notified that this patient is ready for triage. So I'll go back to my home screen here. And before we dive back into Judy's visit, I want to draw your attention to the left-hand side of the screen, which we're calling our clinical inbox. The clinical inbox is user-specific, so each user or staff member has their own inbox that they will manage. This is your task management, and it's also where you'll find incoming faxes. We call this document management or document services. So document services utilizes AI machine learning to read and extract critical information from incoming faxes, ensuring accurate placement in the patient's chart. This is a significant reduction in document processing time, which allows providers to access important information faster, leading to improved efficiency. So AI is not new to Athena. We've been incorporating AI-enabled features into athenaOne since 2016, and we're committed to expanding its AI capabilities to better serve healthcare providers and improve patient outcomes. Going back to our patient visit with Judy Turner, let's take a look at that triage stage just quickly. So for the sake of time, I've completed most of this visit, but when we look at the intake stage, this would typically be done by the MA or the nurse. As the medical assistant or maybe as the nurse, I would have already captured this patient's reason for visit or chief complaint. I may have already captured the patient's vitals, maybe did some medication reconciliation, reviewed some of the past medical history and social history. These are super customizable and reportable. Let's take a look at this patient's chart. We also call this the briefing page. Again, I'd like to make mention to her social determinants of health banner at the top of our page, which indicates that this patient does have a food insecurity. I can also see that this food insecurity is listed as a problem in her problems list. Now, to the far left-hand side of our chart, we do have chart tabs. Let's take a look here at our medication list. So Athena Chart Sync is a feature that automatically consolidates and deduplicates external data, like the medication list, and then presents it in the right place at the right time. We would also look to connect with your vaccine registry so that we receive vaccine data and also push vaccine data into the registry. What we're also seeing here is a list of this patient's encounters. This would also include if they had any dental visits with athenaOne Dental. Additionally, I do see this patient's quality management tab. So based on this patient's demographics and the problems that are in her chart, it is flagging any clinical guidelines or measures that are coming due or any that may be past due. This corresponds to that care gap work list that we reviewed earlier, and this data is going to flow to the appropriate clinical quality program. Additionally, you'll see here this patient, you'll see the Apps tab. This Apps tab allows you to embed third-party apps right into the system, like the Find Help app. The left-hand side of our patient chart or briefing page shows the last visit this patient has had within your center, any recent activity, and then also outstanding orders. So as a provider, let's go ahead and take a look at the SOAP note. So here's the exam stage where I, as the provider, would document the SOAP note. I can document however I'd like to. So I can use dictation, so Athena dictation. I can use text macros. I can use templates. We have structured templates. We have text-based templates. I can copy forward from a previous visit. That's all customizable. Now, in the review tab, it does show me what my NA or nurse has completed so far. So I can see the patient's care plan and see kind of where they stand in that care program. I also can see some of the patient's vitals that were captured by my medical assistant or nurse, as well as that blood glucose level as well. And then that prepare document, right? What did the patient complete there so far? So really, I can document the SOAP note however I'd like. These are just examples of what has already been documented. I do have this patient's physical exam, again, which I've already documented, and I've used a structured template to document this. This patient did complain of a red irritated skin tag that she wanted to have removed today. So we went ahead and took care of that for her. I could have also used Athena Capture to capture an image of that skin tag prior to removing it. We'll take a look at the assessment and plan. Again, most of this I've already prepared for us, but in the assessment and plan, Athena does have an enhanced diagnosis picker powered by IMO. So I can go ahead and add that diagnosis and add the order. The more that I use Athena, it starts to learn my ordering habits and my diagnosis habits, and it'll start to queue up suggestions for me. We do support HCC coding and really to focus providers on recapture rates and not missing a diagnosis. As part of this patient's plan today, unfortunately, Judy Turner's hyperlipidemia is not improving. So I'll go ahead and add a quick text macro to this assessment note. We'll also go ahead and prescribe her some simvastatin. And we can see how the system starts to suggest that medication just based on the diagnosis I'm on. With that prescription, that'll go to her preferred pharmacy. It also gives me access to Epocrates as well. Now, if this patient, so there's my Epocrates there for this prescription going to her pharmacy, and based on her insurance, also would typically show me a price estimate there for her. Maybe we also did need to renew her Linsinopro, so I'll go ahead and do that now. Here's my refill or renewal button for Linsinopro, and that adds it right to the appropriate diagnosis. That's my lisinopril. I also note that we do have a diabetic ophthalmology referral going out for her. We do have referral coordination tools to help manage this. And then we do have a referral out to a case manager or coordinator to assist with her food insecurity. Now, when I'm ready, I would indicate when I expect to see this patient back. Judy will be back in sometime in July for a Medicare annual wellness visit, but I'd also like her to return in about 3 months to follow up with me. This information is going to flow to the checkout desk, so as Judy is checking out or leaving today, the checkout staff knows exactly how and when to schedule her next appointment. If for whatever reason she doesn't schedule this appointment as she's leaving today, Athena will send her an automated reminder to remind her. I'd move on into my sign-off page, which shows you a nice summary of today's visit. Athena will generate the patient care summary and any consult letters for care coordination. On the billing tab, I'll see what codes have auto-populated. So we have our ICD-10 codes. Here's where I would normally plug in my level of visit. I do have my other codes that have auto-populated. So we have the skin tag removal. Also make note of the CPT2 code that has also pre-populated here to close quality gaps with payers. I'll go ahead and save this for now and say that this patient can be checked out, or I can sign off and close my encounter. And from here, we'll move on to the billing workflow. So when we look at this billing workflow, I want to take us to the workflow dashboard. Now, the workflow dashboard is the heartbeat of your revenue cycle. This page is showing us by department or by center or by location. And it really does show claims-related tasks. So you can think about claims that need to be created, claims that require your attention or review. It's also going to show you any claims that Athena would be working on your behalf. Let's go ahead and create an claim so we can walk through that example here. So I have my patient here. She has a claim that's ready to be created. All of the information here is submitted, so I'll go ahead and create the claim from here. Now, when you create the claim in Athena, it'll run through our proprietary billing engine to proactively catch anything that could potentially cause a rejection or a denial. In real time, the system will provide feedback and guidance on next steps. What I'm showing here is that when we submit claims based on, we'll go ahead and submit claims based on formatting. So the claim will split for wrap billing. And once the claim is split, you'll have the visibility into the sibling claim. So it'll tell you what it's doing or show you what it's doing currently. Right now, it's just applying those billing rule logic. It just takes a few seconds here. And then it's going to let us know if there's anything that Athena has identified, or if there's anything that was required, like the wrap billing for splitting the claim. So we're able to see that here. We'll also see a note of it towards the bottom here. In this example, the claim split in order to accommodate extra diagnosis codes. Now, once this claim has passed that initial scrub, Athena will submit this claim electronically to the payer. We'll perform claim follow-up when necessary. We know how long it typically takes for payers to pay on claims. So if there is a payer that's taking longer than they normally do, we, Athena, can initiate that claim follow-up. Now, once the payer pays on the claim, we, Athena, receive that remittance. So we are receiving remittance back into Athena. So we're able to do that posting work. So we are going to post back to the patient's account in the system. If there's any, if the EOB states that there's any patient responsibility, we would generate a statement and mail that out to the patient. All right. So let's go ahead and move on to reporting quickly here. In terms of reporting, we do have a robust report library where you can run reports in real time, or you can schedule what reports to run automatically. And you can also then assign the individuals who you may want to receive these reports. You just select those recipients and then you hit schedule. Now, you'll see the reports here just kind of broken out by category. All of these reports are exportable, so they export into a CSV or Excel file. You'll see the UDS report here, so they have its own tab or own area where you'll find all the UDS reporting. Outside of the report library, we do also have a report builder. The report builder will allow you to build any custom report. We provide you with the resources and instructions on how to use this independently. We can also assist with this, but you can build as many reports as you'd like or as many reports as you need to. We do not charge anything additional for using the report builder. Now, we also do have an activity report. The activity report is going to look at those payments, adjustments, and how things are being posted. A very robust report here with tons of filters, so really you can build whatever report that you'd like. Using this activity report, what we'd like to do here is filter out by the G code. This will really easily allow you to report on claims activity, including CMS CPS claims, and then also provide you with that visibility into how G or T codes are adjudicated and posted. So we'll see a couple examples of those here towards the bottom. And then last but not least, the quality management report. So we started this demonstration looking at the care gap work list. This corresponds with that really. But the quality management report allows you to filter by program or by measure. You can filter by places, service, or location, select specific providers. You can even filter by patient demographic and even insurance reporting category. This is going to produce a list of patients who either have or have not satisfied these different measures. Now, certainly you can take this list and act on it, right, by trying to encourage patients to come in. We do provide a group call campaign to send that outreach to those patients, encourage them and inform them how important this is to their health, to really make sure that they schedule that follow-up appointment with your center. All right, so that concludes the demonstration. And so now I'd like to pass the mic over to Ken Getz.
All right, thank you, Laura. Thanks for the great demo. Ambient in particular is amazing functionality, and I'll just reiterate that every organization is unique. There are a lot of ways to customize your experience, and our team is very well positioned to help you determine what will work best for your organization, and you'll want to find some time to have these more in-depth conversations if you haven't already. As Vice President of Customer Success here at Athena, I wanted to spend some time with you to review a little bit about how we support community health centers here. And I think, first of all, it's really, really important to point out that every single customer at Athena gets a customer success manager or CSM. Now, this is true also with our athenaPractice customers as well, as Tim mentioned, and many of you know, but because athenaOne is 100% cloud-based, athenaOne CSMs have a few more tools to work with their customers because they have a lot of real-time visibility into client performance. And so our customers on athenaOne often have a really close relationship with their CSMs, and in some cases, speaking with them weekly or even daily, depending upon their needs. You're not going to see this level of support at most other companies. Okay, at other companies, CSMs are usually assigned to the very largest customers only, and that's if they have them at all. And so I think our investment in customer experience is really important and a differentiating factor for Athena, especially when you consider the tenure and expertise of our CSMs that they bring to their jobs. Many of them come from practices just like yours and have a very good sense of what it's like to be on the other side. I'm personally very proud of how tenured our CSMs are within Athena, and they know how to get stuff done. And our CSMs are highly, highly invested in your success. And this collaboration is really a hallmark of our approach. I have heard countless times from our customers that their CSM has made a huge difference in their ability to excel and grow. Now, aside from the CSMs, there's a much larger organization and set of partners that are with you in your success, from onboarding to implementation and go live to long-term support. All of these groups, along with your dedicated CSM, are entirely focused on the needs of our CHCs and are there to support you. On the slide here, you can kind of get a taste of these various teams that we work with to drive value for organizations. And your CSM is your primary advocate. They work very closely with these other teams and subject matter experts as needed to leverage their expertise. And all of this is done with the goal of delivering exceptional customer experiences and helping organizations achieve their outcomes. Let me get into this in a little bit more detail. And I'll start with our onboarding team. They are, for example, responsible for working with you to ensure a successful deployment and adoption of Athena solutions. We assign CSMs right after the sales process, and this allows our CSMs to participate in the implementation process and provide support and guidance while working with the onboarding team. At a minimum, what that does is it ensures our CSM is aware of the unique characteristics of your practice and provides continuity as you move from pre-live to post-live. We actually have a dedicated CSM who comes from the athenaPractice world, who is specifically assigned to work with customers converting over to athenaOne. And that helps to ensure that we're all speaking the same language. And our onboarding team has dedicated resources who are experienced specifically working with and implementing FQHCs and who truly understand their unique requirements. We also have a dedicated coaching and training services team. Our CSMs collaborate with that team to develop and deliver training programs for customers. They ensure that customers have the necessary knowledge and skills to effectively use Athena solutions and basically maximize their value that they derive from the platform. They're not just training modules, but also coaching services that clients find very, very valuable. Our highest performing customers take full advantage of these programs. Now, customer success also works hand in hand with our support team to address customer inquiries, issues, and escalations. We collaborate together to provide timely and effective resolution of issues when they arise to hopefully ensure customer satisfaction. But in those cases where a more custom engagement is needed, we have a fabulous consulting and advisory services team. These folks are experts in best practices on Athena and can provide tailored support and guidance to drive your success. I highly encourage newly live clients to take advantage of advisory services all the time to help adopt the proven strategies that will result in higher performance and better patient experiences. Now, we also have a voice of customer team, and their job is not just to listen for client feedback, but also to act on it. And every year we incorporate hundreds of ideas and requests from customers into our software and services. These insights from our customers, they drive product enhancements and improvements. Customer success also works with the product team to ensure that as we have new features and updates, that they're effectively communicated to customers. And lastly, we also have a rev cycle team whom our CSMs work with on especially difficult issues related to claim submission, management, and posting. For FQHCs, we work very proactively with this team. If, for example, to ensure the right rules are in place for our clients' payers. We do something called identify payment pathways, as we call them. It's a major focus of our CSMs when working with community health clients. And all of this is made easier because we have dedicated people on these teams who specialize only in community health. I mentioned earlier that our CSMs are highly invested in the success of our customers, and there's really two tools they use to do this. One is called performance coaching, and the other is called success plans. So performance coaching is where we sit down with a regular cadence with our customers to collectively review where things stand and how we can improve. We do this because we expect our CSMs to not just be advocates for customers, but also coaches who can consult and offer ideas to help our clients improve. We spend a lot of time enabling our CSMs so they can bring insights, data, best practices, and guidance from across Athena to these performance reviews. Now, success plans are written plans that we build collaboratively with our customers to ensure that we're aligned with your goals with regard to Athena, not ours. So the plans are intended to help us ensure we're working on the right things, that we're working on them together, and then with the right priority to achieve the best possible returns on your Athena investment. Now, I mentioned our voice of customer team earlier, and I thought I'd just spend a little bit more time on that. Our customer success managers and VOC teams actively listen to customer feedback and insights. And because the system is cloud-based, our product team reviews data on how our users are actually using and performing within the system. So our goal here is to ensure voices are heard and that we can improve the product experience based on real data about how it's actually being used. 38% of the enhancements to our products last year in 2024 came from customer feedback. Our CSMs actively engage our customers to participate as well in alpha and beta feature launches to help accelerate the value from these sorts of product innovations. Now, lastly, I really didn't want to not mention more about advisory services. And I'd like to double click on that briefly because they do such a stellar job working with customers and especially FQHCs, which is why I chose this case study here, which showcases one example of how our advisory services team worked with one FQHC, in this case, Centerplace Health, to analyze and improve workflows, streamline their billing processes, reduce claim rejections, and improve time of service collections. And I recently participated in an advisory services engagement where the advisory team brought a team to tears because of the time savings they were able to produce as a result of their expert engagement. So I strongly recommend taking advantage of these sorts of services whenever I have the chance. All right. So as much as you may have appreciated hearing about all of that from myself, there's really no better way to understand the experience than to hear directly from a customer who has been in your position and who has lived through the actual process. So that's why I'm really super pleased to introduce Jessica Jones, Quality and Compliance Director at North Country Family Health Center. So let me just say a few things real quickly about Jessica. She brings firsthand experience, perspectives as a former athenaPractice customer who played a direct role in her health center's transition to athenaOne in 2020. She'll be sharing her journey from the decision to make a change through the conversion process and into the continued success she's experienced with athenaOne and the support of our customer success manager. So thank you, Jessica, for joining us. We appreciate you being here. And maybe before we begin with the questions, we'd love to just take a moment to learn more about you and your health center. So maybe could you please tell us about your role, your background, and your health center, and how long have you been on athenaOne?
Sure. Well, thank you, Ken, and hi, everyone. As Ken mentioned, my name is Jessica Jones. I'm the Quality Compliance Director at North Country Family Health Center, which is an FQHC located in very northern New York. We're right in between the St. Lawrence River and the Adirondack Mountains, about an hour north of Syracuse. We see about 16,000 patients a year for medical, dental, and behavioral health services across 5 community-based and 14 school-based sites. We also operate the WIC program in our 2-county service area. I started as a health informaticist at NOCO just a few months after they had transitioned to their very first EHR, which was Centricity Practice Solution at the time, in late 2012. I also helped the practice transition from paper to Viz Dental, their first dental EHR, in early 2013. And continue to manage our HIT initiatives along with quality, value-based programs, population health, compliance, doing a little bit of everything over here, and still overseeing our HIM and EHR work. So I've also led our agency's UDS submission since our first report back in 2013. And then in 2020, we made the decision kind of midway through the year to transition to athenaOne and went live in October of that year.
Yeah, that's fantastic. And maybe, Jessica, you can spend just a little bit of time about discussing a little bit what makes your health center unique.
Sure. Well, we've been serving our community for over 50 years. Our start was really in children's health when local community organizers recognized the lack of well child care in our area for patients between birth and when they started school. So we opened one of the first WIC programs in the country in 1974. We introduced integrated behavioral health services in the early 90s and have operated school-based health centers in our area districts for over 30 years. We have had certainly some difficult financial seasons, including just shortly after becoming an FQHC, but we have persevered and we are in a growth period right now. We just added a pharmacy on site and a new practice location in the past year.
Oh, that's fabulous. So let me pivot now in a few of the different areas of interest. And I think first up is the whole decision making around the conversion process. And my question is, what were the driving forces behind your health center's decision to change systems in the first place? And then how did you go about doing that? Was it a formal process? Did you look at other vendors?
Sure. So we were kind of facing some required upgrades to CPS at the time, and an integrated system with that tool. When we were approached by Athena with the option to move to the flagship EHR product, and this was just a few years, not too long after Athena had kind of taken over the former Centricity product. So we were certainly not planning to make a move, especially kind of during a global pandemic. But the ROI that was presented to us was really key in our decision making. We were moving from a VPN connected kind of virtual server environment to a cloud-based environment that had much higher uptime. So we were experiencing a lot of significant downtime and high cost with operating that environment, and just really saw the improved efficiencies across the board. We had done a rapid performance improvement project with Coleman Associates a couple years prior, and really felt like some of the data that we wanted to monitor as a part of that project to make sure we were meeting those objectives, we just didn't have that functionality in athenaPractice. So, encounter closure rates, how long is a patient taking at intake in the exam room with the provider? We were doing all of that manually, and those are functions that athenaOne has built right in. We didn't really look at other vendors. Honestly, at the time, we did a project a couple years earlier where we had investigated another EHR vendor that's very common with other New York State FQHCs. And we really felt comfortable having done that analysis moving forward, kind of knowing what else was out there in the market, moving forward with athenaOne. And, it was early COVID, so our leadership team was meeting daily for hours at a time. And so those conversations and decisions were able to happen pretty quickly.
Yeah, great. Let's talk a little bit about your partnership with Athena during the whole process. So maybe starting with onboarding, how did our teams collaborate with you ahead of the go live, and then during the onboarding process? What worked well in onboarding, and then maybe what didn't work so well?
Yeah, so we had regular onboarding meetings with all team members to get really high level updates.
Mhm.
And there was sort of this series of subcommittees of groups that sort of specialized in certain components of the onboarding process. So imports and integrations, the RCM was a component, clinical build, data and quality. And so our team really appreciated those subcommittees because it meant that everyone kind of went to where their focus and their kind of skill area was, and didn't have to go to everything because that could get really intensive. We did have a great project manager who was really great about having a very detailed project plan, keeping people on task, making sure that everyone knew kind of where things were in process, was very responsive. I think it's important to know that Athena's goal is to train you on how to build and edit the system, how the product actually works. It's your job to translate how that functionality is going to work with your workflows. So there is thought and prep and involvement of your team that goes into that. It's not, the work doesn't all happen in the meeting. So that's something just to be mindful of, I think. We struggled not being able to have a clinician that could really join us for every single one of those meetings. So there was some extra work on our team, specifically with that clinical build, where we had to kind of go back to someone else, explain, the rationale or kind of what we were thinking in terms of build, and kind of get that buy-in.
Yeah, you started going into it a little bit, but I was going to ask if there are any specific workflows or programs specific maybe to CHCs that you think required special attention during the onboarding process.
Yeah, I think for UDS, certainly capturing some of those registration or demographic specific elements. So what do we consider as a required field? Might be different than what a private practice without those, reporting requirements would. And then educating staff on best practice workflows for those, how to make sure that we're reporting accurately, documenting accurately. And then on the financial side, there's certainly setups like sliding fee scale, the FQHC specific billing rules that needed to be addressed, make sure that those were turned on for our practice. We did have dental services there was no athenaOne dental at the time. So we did move to a separate system for that. So really considering the interface and how UDS and financial reporting workflows were going to work, having that kind of bi-directional with an external EDR.
Change is hard, right? No one truly likes change. So I'm wondering, how did you get the staff behind the project, and what kind of a difference did that make? Are there any specific lessons learned, or what would you do differently that our audience should keep in mind?
Yeah, so we shared our kind of thought planning with our provider team very early on. We had them attend, I think it was a few hours long, honestly, a webinar on athenaOne, so they could kind of get acquainted, get a little demo, and ask questions. I think we did have some providers that were really very interested in making a change, who were really very frustrated with our previous system and felt it was really clunky. So once they saw it, they were on board. I think too, we really looked for those change champions at every level. So we're, from providers to MAs, nurses, front desk staff, who would really be positive about the transition, who would, kind of hear what's being whispered in the back and bring that to us so we could address that, or answer any questions that people, maybe didn't bring to the transition team. And then helping people who really want to be super users, or who kind of have that skill, who are great at training, who are really good with technology, who are interested in knowing a little bit more about the system, going a little bit deeper, and really investing in them to protect their time, to make sure they were able to get through all of those, pre-go live training modules, that they could do kind of not just the foundational learning, but build upon that. And then really, elevate them among their team to really be that go-to person. And, there are always people who are more change averse. So sometimes we would pull those skeptics in. We'd say, come on, we're going to go, we want to work on this build, and, we want to hear what you have to say. And sometimes, showing them, the secret of the sauce a little bit of like how things are getting built demystifies it. And, they feel a part of it and have kind of that safe place to ask questions, or to, question why you're making a choice, and, they get to feel included. And sometimes that's what it is. People are hesitant because they don't feel like they're being heard. And so we just pull them right back and say, you're going to help us. Let's work on this together. And that really helped.
Yeah, that's 1,000% a fabulous best practice, and I've heard that from other successful customers, is making them part of the solution. I'd love to pivot a little bit to post go live. So, in the customer success world, we're here to support our customers and to work in partnership to help our customers find their greatest success. And the role of the customer success manager, as I mentioned, is, I think, really critical to that achievement. Now, your CSM, Christopher, shared that your entire team, your CEO, billing team, clinical team, are all actively involved and work together to ask questions, express concerns, and pay points. And it sounds like you have an established monthly cadence for performance calls, which is great to hear, along with other ad hoc meetings as needed, which is fantastic. So I guess really my question, and don't worry, you won't get them in trouble, but how has your CSM contributed to your health center's success since transitioning to athenaOne? And maybe you can talk a little bit about those monthly calls and in what ways your CSM is proactive, and what does that mean for you?
Sure. And I would be remiss. I know you talked about how, some customers have great relationships with their CMS or CSMs, to not mention our first CSM, Samantha, who has now moved on to kind of the overall FQHC team. She was fantastic. So happy that other health centers are going to benefit from her knowledge and advocacy. But yes, Christopher is great. He does a great job of being data forward, which I think is really kind of across the board at Athena, but really looking at the RCM, the user metrics, that can give us that insight into our practice that we've never had before. We moved to athenaOne. So really looking at here are the specific data points. Here's kind of where claims are in hold and kind of drilling down into that. Where are dollars sitting that we need to take action. In terms of user metrics, looking at how providers are utilizing the system. Is there someone who's way outside the bell curve in terms of their time that's spent outside of their business hours doing work, and how do we use the resources, whether that's some of the accelerators within documentation or that's that one-on-one coaching, to support that provider. So really helping us kind of dial in. So we're fixing problems instead of spending time trying to find the data just to identify what those are.
Yeah.
And I think CSMs that really understand FQHC models it is very important. So he really is an extension of our team. He's the person who kind of sits in between Athena and us. And so we really look to his expertise, connections, advocacy. They might not have the right answer right away, but they're going to find it for you.
Yeah, and on that note, we specialize our CSMs, right? With the team of CSMs that supports community health centers is part of a larger team, and all they do is work with FQHCs and community health centers. So agree completely that level of detailed expertise in the specialty is really, really important. I'm wondering if you could share a few specific instances where Christopher has provided support, or maybe Samantha, where they helped created a significant impact on your operations. And also, I'd just love to hear your perspective on overall support, the CSC, success community, all the other resources at your disposal.
Sure. So our CSMs have helped us escalate support tickets, share resources with us, like just recently shared FQHC best practices calendar, which gives you a breakdown of daily, weekly, monthly, tasks that you should be completing that covers a multitude of domains. RCM is one that we're really dialing in on right now. So that was super helpful for us with the new RCM director on board. Connecting us with other Athena teams. So for coaching and optimization. So again, talking about like, we've got a provider who's kind of falling outside of that bell curve. Let's get them set up with that one-on-one coaching. Or we did a portal and web scheduling optimization project last year. And so helped kind of connect us with that team to get that started. When we were setting up an interface with Exact Sciences, the Cologuard people, to do order and result delivery, Samantha kind of jumped in and helped make sure that project was moving forward in a timely manner, which is really, really helpful. I think the success community has so much information. It can be a little bit overwhelming, but it really is a great resource. I just will plug the FQHC user group, which is really helpful with regular meetings. Customers can go in and ask questions of other customers in that group. Being able to see what other enhancements people have suggested. So I think, talking back to kind of the number of enhancements that are driven by customer feedback is really innovative. You don't really see that at other vendors. So, being able to see what people are suggesting, commenting on that, being able to upvote those, and kind of help those get across the enhancement finish line is really great. Alpha and beta testing is awesome, right? Like being able to be a part of the development process. It's not kind of shrouded in mystery. You can go on and you can see what is in development right now, and you can put your hat in the ring and say, yeah, we'd really like to try that. That's just, it's so great as a customer to be able to have that input. And then with the CSC, there's been some recent updates that I think are really helpful. So when you're typing out your ticket and putting in your issue, it actually will scan the community for potential knowledge articles that are related to it, and it'll say, "Is this what you're looking for?" And it will kind of help you drill into that. So sometimes I've been like, "Oh, I don't even need a ticket. Here's the answer right here." Pretty quick turnaround time for responses when you do put in a ticket. I like uploading screenshots, to show exactly kind of what's going on. So super easy to do that. Closed tickets you can reopen or comment on. And then what's really helpful for us is sometimes we have folks who may be responding. I can look at tickets that my team have put in, so you can view tickets kind of across your practice and support your team members if you need to, which is really helpful.
Yeah, that's super valuable. Well, I'm going to switch gears just a little bit, and I'd love to talk a little bit more about your experience actually on athenaOne, and maybe can you provide maybe some anecdotes about how the athenaOne mobile app, Athena Communicator, or other tools have improved your workflow compared to what was available in Athena Practice?
So Athena Communicator, I have to shout this one out. Just such a great tool to have in the toolbox. As the quality and population health leader in my organization for the past 6 years, being able to automate patient recall, outreach, gap closure campaigns with very limited staff takes a huge administrative burden off of our plate. Previously this was something that we had to outsource. We were paying additional fees on top of our EHR to be able to do this, and being able to pull that back and have that integrated within your system, being able to use that care gap list to kind of pull a list of people who are due for services and send them automated portal messages, phone calls, emails, being able to reach them after business hours when people are more available, maybe to hear a message or to kind of connect with a live operator and book that appointment that we're telling them that they're due for, is just so beneficial. We used Athena Communicator to do a colorectal cancer screening campaign. So we targeted patients based on age and documented family history. We pulled lists of patients who were due based on their open care gaps, and then patients who had documented family history of colorectal cancer. We limited that open gap list by age, and then we wrote specific scripts for 3 different populations. So folks who were turning 45, so coming due for the measure, folks who were kind of new 45 to 50, kind of that younger group, and then the family history group. And we were able to automate messages out to those populations during colorectal cancer awareness month, just remind them of early detection, importance of screening, how to talk about it with their provider. And that was like hours of work, took minutes. It was just so awesome. And then the Insights dashboard have been a great resource for us. So we're tracking digital patient engagement as part of our front desk initiative. So we're monitoring that monthly. We are looking at provider and staff workload with the clinical insights dashboards, so we can monitor how new providers are doing, and like I said earlier, where they might need some additional support.
That's fabulous. And you kind of took a little bit out of the next question I was going to ask you, which is how have these AI powered tools within athenaOne helped improve the provider and the patient experience? And I guess I'd also be interested in how have these tools changed the way your staff interacts with patients or manages their daily tasks?
Yeah, so we certainly have reduced out of office working time, which is a huge driver of burnout. And we certainly were seeing that ahead of our transition. Providers were really feeling the pressure. Same day encounter close rates, those certainly help make sure, referrals can't go out the door without that encounter signed. So it helps our referrals team, when providers are able to close their notes quickly, get those patients connected to specialty care faster. Patients are able to view their visit notes, schedule appointments through their portal. So that helps with patient access. And it also, the front desk loves portal web scheduling because they don't have as many phone calls coming in for appointments. Patients are able to be, self-sufficient in that way, which is really helpful. And then it keeps those phone lines open for patients who really do need to talk to someone at the practice. And then
Yep, go ahead.
yeah, sorry, the communicator results call. So, we are a patient-centered medical home. We're required to let patients know about their results for lab and imaging. And so being able to automate that a little bit is super helpful for our clinical staff. They can focus more time on, really direct patient care.
Yeah, absolutely. And then I guess the last thing is, what about the feedback you received from your patients in the community regarding some of these innovative features within athenaOne, and how have those tools specifically impacted their satisfaction and engagement?
Yeah, I think our patient satisfaction scores are in the high 90%. We're seeing lots of patients kind of start to engage digitally with a practice, which is awesome. I, will speak as a parent of a patient as well. My kids come to NOCO, and as a busy parent, it's super helpful to log into their portal and schedule their well visit, even if it's 9 p.m. on a Saturday when I remember, oh, they're due. I can go in and schedule that appointment, or I can send a picture of a form for school that I need filled out, or hey, doc, my kid's got a rash, what's going on here? I can send a photo of it right through the portal, which is super helpful. And, you know, I think that is certainly reflective in what we hear from our patients as well. They really like the ability to go in and kind of have that direct access to their health information. The portal is so much more user friendly, you know, having been a user of our previous portal, very user friendly, very clean and simple, super easy to pay a bill online. You know, we didn't have the ability to pay online before, so that has been really appreciated by our patients for sure.
You briefly mentioned earlier the Insights dashboard, but I'm just curious, what about reporting?
So I mean, I think for us, we really struggled with reporting in athenaPractice. You know, the reports, the integrated reports module was, you know, Crystal, which was really time consuming, difficult to learn. We just didn't have that in-house expertise. So virtually everything we did was external or done from a third party, which again was an extra cost. So with athenaOne, you know, you have that ability to run those ad hoc reports with no complicated program to learn. You know, it's really very simple. And if you are stuck, you can always ask your CSM for help and, you know, or put in a ticket and get assistance that way. You can create reports, you can schedule them to be sent to you automatically, which is really helpful for us. You know, I've got some standard reports I look at every month and they just show up in my inbox without me even having to do anything. You can edit, you know, if you build it and you're like, oh, that isn't quite right, you can always go back and kind of edit and filter. You can share them with other people on your team. You know, and then the national quality reports like HEDIS, the CMS ECQMs, UDS, PCMH reports, you know, our previous system didn't have any of that. So you can really you know, use this tool for that reporting. And then, you know, in the past few years, we've really gotten the ability as practices to manage those program enrollments and how those things show up in the chart side to remind providers that, hey, you know, touch on these quality items. We have the control of doing that now, which is just a great enhancement, has been really helpful for us.
Well, I'd love to just continue this focus on results on athenaOne, and I think that's really important. Something that we in the CS world wake up every morning thinking about how we can help our customers get better results. I'm wondering if you can share some examples of how athenaOne has led to some measurable improvements in patient care, provider satisfaction, or organizational efficiency.
Yeah, so digital patient statements, so patients who are electing to receive their statements electronically are up 5 percentage points in the past year. As I mentioned earlier, previously we had no way to accept online payments, and about 40% of our patient payments are made digitally now. We have earned, the past 2 years, we've earned Health Center Quality Leader badges from HRSA in silver and bronze because of the way that Athena surfaces those open quality gaps during encounters. It really supports staff in being more efficient and effective at chart prep and huddling. I think even the prep functionality within the chart just really supports you know, our care teams and getting ready for appointments, makes those huddles more actionable. Providers really like having more autonomy over their documentation style and customizable templates, text macros, order sets. You know, in our previous system, there was a lot. It was sort of, you know, very standardized, but now providers kind of have a little bit more stylistic control, which I think is really helpful for their own satisfaction. And then training courses for new users. I mean, we used to spend hours of staff time training new staff, both administratively and then on the clinical side when they made it to the floor. And so now we, you know, staff learn the functionality from these modules that they have through Athena, and then, you know, staff can really help them with the workflow adaptation of that functionality. And do spend more time working on direct patient care and strategic tasks because they're not spending, you know, a whole day training somebody.
Yeah. Well, in speaking about time, let's talk about burnout briefly. I mean, I'm curious how the transition to athenaOne helped address issues of burnout among your staff and providers, especially in light of the increasing demand for value-based care.
Yeah, our providers have seen about a 30% average reduction in documentation time spent outside of business hours, which again, I think is a huge driver of burnout among staff. surfacing those actionable items for care teams before and during encounters, really streamlining documentation into that 5-stage encounter approach, allowing our providers to customize within guardrails, so they're not kind of soup to nuts building the whole system themselves, but they do have the opportunity to kind of, this is how I like to, this is the kind of language that I like to use, or this is the education that I prefer for this diagnosis. Being able to automate some of that stuff, they're not spending so much click time to kind of pull some of that data into the system. Our previous EHR was very click heavy in terms of our content. And so being able to kind of automate some of those simple repetitive tasks for them really frees them up to, to do the documentation and the key areas that they really need to. And then just being very data driven in terms of, what we need to focus on, looking at the system utilization, RCM. It's all data that's helping to improve this system, but also how we use the system to make things, better for them. In terms of value-based care, there's reporting on HCCs, suspect condition integration from payers, CPT2 coding. Those are all resources that we have used to support, our value-based payment initiatives. And so I think just making our care teams more efficient and effective in care delivery, and then RCM as well, being able to capture those elements that support VBP has been really key for us.
That's great. That's great. Well, thank you for your thoughtful responses, Jessica. Please stay with us just a few more minutes. And Tim, I'll bring you back if you could join us again, and we will bring up the questions that came through.
All right, I'm back. This has been great. We got a couple of really good questions in here. The first one, Jessica, you sort of hit on this already, but I'll see if you want to maybe add a little more. There was just a question of you sort of commenting on your view of the provider experience at your clinic.
Mm-hmm. Yeah, I mean, I think before on our previous system, providers were really feeling the pressure of increased documentation. The documentation was a little bit unwieldy. We were using documentation that came from a third-party vendor and was very detailed, but I think providers felt a little bit overwhelmed by it. And so moving into a system that just has a much cleaner look, and again, that kind of streamlined 5-stage encounter, the documentation, like the flow of that visit was just so smooth. They really appreciated that. And we did have some performance improvement activities that we had done about streamlining visits and making, making them more efficient in the encounter and moving the encounters more quickly, because we were just spending so much time kind of clicking through radio buttons and checkboxes. And, now kind of on athenaOne, that documentation is really streamlined, and providers are able to move through encounter. Staff are able to move through encounter documentation so much quicker now, which has reduced our appointment, time that patients are spending in the exam room, which is really beneficial kind of all around.
Awesome. One other one for you, and then we get a couple operational sort of questions that I think I'm going to grab one and then send one to you, Ken. But just, vendors love to talk about partnering, right? But, can you talk truly, like, how do you view Athena as a partner and a collaborator with your community health center?
Yeah, I think Athena does a great job of listening to their customers, talking about prioritizing enhancements that are really going to benefit them. Even just allowing customers to say, hey, this enhancement would be great for us, and everybody else kind of voting on it, and then saying, all right, hey, people are really into this. Let's add that into the roadmap, or allowing customers to be able to have that transparency over, here's what we're testing in this system, and if you'd like to participate, let us know, and allowing customers to do that in those alpha and beta projects is really collaborative, I think. I know very recently New York State is working on a project right now related to health-related social needs screenings, and the state requires a very specific screening tool to be used in order for sites to be reimbursed for performing that. A lot of New York State sites said, "Hey, Athena, we know that you have the full screener and you have the partial screener, but New York wants something kind of in the middle. Could you please build this for us?" And they said, "Yep, here you go. In your spring release, here it is for those New York State sites." So I think that is a very recent, a very good example of, they really do listen to what the customer is looking for, and then they, guys put it into action.
Fantastic. That's super helpful. The next question I'm gonna take was a question about a customer out there who's hosted on athenaPractice today and wanted to know sort of what would that look like on athenaOne? And so the good news is it's going to look even better because athenaOne is a truly cloud-based single instance multi-tenant platform. You just need to get to the internet. That's it. So no servers. And though you're hosted today, obviously you don't have servers, but no VPN, none of that kind of stuff. No worrying about upgrades being dramatic in your organization, going forward. So there's a ton of advantages. Plus, being on this network, you're sharing information. Everybody's getting smarter by being, on that same network as we learn about, different information, be it revenue cycle rated, clinical, et cetera, et cetera. We share that information back to help everybody improve. So, and Jessica, anything you want to add to that, actually?
Yeah, I mean, we were in that same boat. We were a hosted customer on athenaPractice, and I think we also felt a little bit of that anxiety. We had a great hosting partner that we really worked very well with. And so we were a little bit nervous. But yes, I would say those very painful weekend-long upgrades, those don't exist anymore, right? And the uptime for us was a huge benefit, just because we were having so many issues with the uptime with our previous system. So yeah, all good.
Thanks. And then last question I've got here, Ken, for you. It sort of rolls right into what we were talking about, quite frankly, is so when Athena comes out with new features and functionality, how do we communicate that out? How do we make sure that our customers are trained and ready to go?
Yeah, that's a great question, Tim. Athena Health releases major updates about 3 times a year. It's a very predictable triannual schedule, which I really appreciate, and I think our customers do too. In fact, we just had our spring release a few weeks back in March, and at least 1 month prior to those releases, when we have new functionality, we publish a release center that provides all of the in-depth details and video guides and everything for upcoming changes. It's all sortable by staff position affected by those changes, which is really helpful. The product that's updated and the level of change management or training that may be required for each update. So it's really well done. For particularly heavy changes that require maybe a little bit more change management, just like some of the recent scheduling changes, for example, we send automated emails to practice staff who have been listed as responsible for training to make them aware of upcoming changes and resources that are available to them. Additionally, to further support clients during releases, we hold release walkthrough webinars to highlight key features that all Athena clients are able to attend or watch on demand. Our CSMs are provided with training and user guides, and then they can create that content with key features for their clients specifically. So it's customized to share with the client and their staff as part of their regular touch points. And of course, our user groups will also highlight and cover upcoming specialty specific changes and new functions as well when they meet. Lastly, one really cool thing we do, about 10 business days prior to our release, clients are able to begin testing key features in a preview environment, so they're able to ensure they're comfortable with changes or even make their own training videos for a more personalized approach for their practice. And I don't know, Jessica, if you have anything you want to add to that.
Yeah, I will just say also when you log into AthenaNet, kind of a little bit before the release, it actually will pop up and say, "Hey, your release is scheduled for this day," and your AthenaNet homepage kind of gives you those quick links just to get to that release center and to view those updates. And yes, the roadmap webinars kind of highlighting what's coming down the line, and then what is coming for this immediate release are always really helpful to view.
All right, awesome. So Jessica, I have just one final question for you before we wrap it up, and it is, what is the best advice that you can give other Athena Practice customers as they consider making this critical change to their business?
Yeah, I think kind of understand why you're making this decision and set goals for yourself. What are you hoping to achieve with this change? And really, identifying where are we now and where do we want to be so that you can really measure that progress, making sure that your key team members, including those change champions at every level, are on board with this, and really make this a strategic priority. If you're moving forward, it is time and effort intensive, and really protecting the capacity of your team that's going to lead this work and make it a successful transition. But yeah, I think we are so happy that we made that change, even in a very difficult, kind of unprecedented time. It really ended up being such a great move for us.
Awesome. Well, thank you, Jessica, for all of your thoughtful responses. It was a pleasure having you join us for our panel discussion today. And Tim, I'll throw it back to you.
Thanks, Ken. Appreciate it. And Ken, thanks for leading the conversation. And Jessica, thank you for participating. Really, really appreciate it. And I'll just add that I think I can speak for you, Jessica, by saying for those out there who are listening and listen to Jessica, her story, she'd be happy, I think, to talk to any one of you that would like to learn more from her, or if there's other of our customers, whether they came from Athena Practice or not, your sales executives are happy to connect you with folks so you can learn a little bit more again about what that transition would be like moving to athenaOne. So just to wrap up a couple of things, of course, we have to do a little bragging, I guess, at the end here. And I assume most folks are familiar with KLAS, which goes out to customers and sort of measures satisfaction with vendors in the healthcare IT space. And, we're very proud over the fact that in particular, in the last 2 years, we've won the award for overall independent physician practice, beating out some folks to the Midwest of us for the last 2 years. So really, it just says a lot, I think, about what our customers say about the performance they get on Athena. And then just to sort of summarize a little bit about what you've heard today, just hit on these sort of 3 things about this unique partnership model. One is that, again, it's this idea of a network-powered intelligence. So like I said a few minutes ago, it's a single instance of software. And because of that, we can give you lots of information to compare you to peers, to help improve performance, all that kind of stuff. And then beyond that, it's not just the technology, right? There's a service component, as you heard about from Jessica as well, too. And it's focused on outcomes. It's focused going back to those mission and vision statements of yours of helping you achieve your mission and vision. And again, you heard from Jessica about, that it is truly a partnership and it's driven around performance on what's important to you in your organization in achieving those goals. So I want to thank you all again for taking the time to be with us this afternoon. And again, I really, really want to thank you for being customers. It's incredibly important to us. You're what makes us go. So thank you so much. And then as I sign off here, we're going to have a survey that'll pop up. So if you could take a second to fill that out, that would be really tremendous. We view ourselves as teachers and learners here at Athena. So if you can give us some information that'll help us continue to learn and do better the next time we do one of these, we'd greatly appreciate it. So thanks again, folks. Have a great rest of the day. Take care.